Biden's vaccine mandate on private employers has finally been released. The Occupational Safety and Health Administration published the emergency temporary standard in the Federal Register, making it official that employees at businesses with at least 100 employees must be vaccinated or undergo weekly testing. This is, of course, on top of the federal mandate that people who work for the federal government or are federal contractors or members of the military also have to get the jab or else. Is this really an emergency that justifies these orders? Is the Biden administration acting lawfully? To help unpack this rule is Roger Severino, who's a senior fellow at the Ethics and Public Policy Center. Roger, welcome back to Washington Watch.
Glad to be back.
Well, first, are there any surprises in the actual rules based on what they had told us was going to happen?
Not really. This decision was pre-cooked. Now, recall that the president himself originally said he did not have the legal authority to do a vaccination mandate. Well, look how much has changed since then. He ordered OSHA to issue this mandate. And normally you don't just tell an agency what to do. They're required to do fact-finding, have open comment period, let the public have their say. But no, it was a presidential order. So we should not be surprised that OSHA did what they were told, which is it's effectively find a way to impose a national mandate using whatever trick in the book they had. This is coming out of OSHA, a small agency with the Department of Labor, as opposed to, the Department of Health and Human Services, which you would expect would be the agency to have authority over health. But they picked OSHA because that's the best they can do. It's a fig leaf to cover their push for a national mandate. And they're using this emergency standard that I don't think really holds water.
Do you think the lack of following protocol, public hearing periods and things like that is one of the grounds on which this will be challenged?
Yeah, the standard is it arbitrary and capricious and contrary to law? To run around the regulatory process, which normally takes years, from 4 to 11 years for an OSHA regulation, to get past that, they declared that this was a grave danger in the American workplace, and therefore they needed to impose this emergency standard. Well, we've had COVID for quite some time. The vaccination rates are approaching 70% for at least one shot. What is unique about the federal workplace as opposed to any other place in America that makes it uniquely dangerous? It was their burden to show not only that a workplace is dangerous, they are saying that workers are dangerous. And that's just not part of the authority. If you think about OSHA, they regulate the heights for railings in construction sites or chemical exposures in chemical plants. Here, they're treating the workers themselves as some sort of a threat in the workplace. And that's just not how OSHA was designed. It was about the workplace, not workers.
You refer there to the grave danger, and that, of course, is required for there to be an emergency order of this kind. The law gives those emergency powers when they have determined that there is a grave danger. What did they do to justify that? What did they say? Is there any kind of finding that they even reference to say there's a grave danger in the workplace that justifies these new rules?
It's rather weak. And I made a presentation on behalf of the Ethics and Public Policy Center to OSHA before they adopted the rule. And the one issue they raised was the question of grave danger. And first, most people in the workplace that are at risk are of the older variety. However, in the American workplace, you don't have retirees in the workplace. They are retired. So the people most at risk in the workplace are not in the workplace, right? In limited numbers they are. So that was one of my major points. I said, you have to tailor the risk. This is not a national issue under your authority. Your authority is the workplace. So what is unique about workplace dangers? They're not able to point to anything specific. When you think about the massive variety of workplaces, you have people who work in construction, outdoors by and large. You have some businesses that are already requiring their folks to be vaccinated, and they're above 95% vaccination. Are you going to impose a mandate on them? There's workplaces that already have very strict rules on masking, testing, and social distancing. So they're using a shotgun approach to treat all workplaces the same and all workers as somehow threats, and they do not have the evidence to back it up, especially now that we have improved treatments, such as the one that Pfizer is close to putting in trials that cut the risk of death and hospitalization by 90% if you already have COVID. they're acting as if this is a brand new threat from a year and a half ago, as opposed to the modern data we have now. And that's where they're going to be legally at risk.
Are there any examples of this administration or other administrations using this emergency power, citing workplace grave dangers that would help us understand whether this is appropriate or somehow unprecedented?
Well, OSHA has done this before, but in other instances, it was litigated, and 5 out of the 8 times they did it, they lost in court. And famously in the 80s, with regard to asbestos in the workplace, they tried to use the emergency standard and they lost. It is a tough thing to do, to simply declare that the entire American workplace is now a place of grave danger when we've lived with this virus for so long, and they're not even taking into account natural immunity. That shows that it is irrational if you are saying that we're going to ignore people who have natural immunity and we're going to require them to be vaccinated because they also present a grave danger. That is flatly unscientific to lump them all together. But this is what you would expect when it's rushed. You don't do the cost benefit analysis. And when the president himself had ordered it, it was already baked in that they were going to do this. They didn't listen to the counsel I gave when I presented to OSHA. They're not going to listen to the American people. They may listen to a federal judge when I hope this gets struck down as beyond the authority of OSHA.
We've got about a minute left. Speaking of federal judges, we've already heard reports of lawsuits being filed against these regulations now that they have been released. What are you expecting in the courts?
Well, you will see a lot of skepticism from the courts on this. As we saw in the Supreme Court when it came to religious liberty, at some point, you have to end the declaration of emergency. At some point, all of a sudden, you've changed the baseline where we're always under emergency. When we're under emergencies, that's when liberties are put most at risk. And this has been quite a long time to be declared under emergency. And they didn't act before. And I think that window has now closed. Infections are down 57% since its peak a couple months ago. They are now more trying to make a point than address the public health concern the right way.
To borrow from a favorite movie of mine, The Incredibles, when everything's an emergency, nothing is an emergency. Roger Severino, really appreciate your time today. Thanks for joining us.
You're welcome.